had some trouble last week with my microphone. Hopefully, this week it got all straightened out. So I'm just going to wait for a minute or two for you guys to start popping on board. And I'm going to enjoy my favorite decaf coffee. All right, folks. As you jump on board, I would love to hear who is out there, guys. Give me a shout out. Give me a thumbs up if you can hear me okay with the new microphone. As usual, with technology and it takes me a little bit of time to get used to the new tech that I was given. Hey, Megan, we got Karen on board. We got Eric on board. Hey, guys, how you doing? Can you guys hear me okay? Jody in the hospital. Jody, what's going on? Steven saying hi to Bob. Yeah, Bob's here. Bob's still having a hangover from that last party he had. All right, Eric, walking better. Good, Eric. I am so glad to hear it. Casey, hey man, I'm so glad you could join us this evening, especially with everything you've got going on. So thank you for joining us with your Jack and Coke from Jacksonville, North Carolina. We've got Jeanette. Thank you, Megan. You guys can hear me. What's up, Mark S? What's going on? Bonnie, your package just went out today, so you should be getting your Cozy Talks mug very soon. We've got Stephen Baxley from Bama. Roll Tide. We got Eric drinking his Pepsi, Dick Devers on board, Phyllis listening in from the YouTube channel. Guys, I am broadcasting from my YouTube channel. So if you prefer to listen from YouTube, watch from there. If you know of somebody who has been trying to join in, but they can't find me on Facebook, because Facebook can sometimes be a little sneaky that way, it might be easier to jump onto my Cozy Talks YouTube channel and find me there. We got Ashley on board, Kenny. These names are flying. Hey, you found me, Andrea. Yeah, I was a couple minutes late. I'm finishing up geometry homework with my oldest daughter, and I've got an extra visitor here. You guys can see Snickers there. That's our family cat, and this is her favorite perch. So she'll probably be joining us this evening. Ashley from a snowy 23 degrees in Tennessee. Man, y'all getting hit by this winter, whatever it is that's going on. It's really tearing things apart. We got Brett on board. Susan, awesome. I've got a lot of your questions here tonight. A lot of really interesting questions that we've got tonight, new ones that I've never answered before. So it'll be interesting. We got Rhonda Jones from Missouri. We got Tom McIntyre. Tom, your ears must have been burning today. We were having a conversation about you and how wonderful you have been in helping support organizations like myself and Socket Sock. So Tom, thank you. Thank you to from both of us. We've got Cliff. Dude, haven't seen you in a long while. What's going on? Hey, Olguita, what's going on? Olguita, homebrewed Starbucks, coconut creamer. Oh, awesome. Sitting in your new amputees. Yes, Liz. We've been getting a lot lately. I don't know, in the past couple of months, I've had so many new folks joining on the show, which is wonderful. It means that the word is spreading and people are going to hopefully get a little more access to the information and resources that we have available here on this show. So guys, those of you who've been helping me promote the show, it's basically, organic reach. So thank you again, guys, for those of you who've been helping spread the word, bring the news of this show to your support groups, referring people to me who have questions. Truly, truly appreciate it. So thank you. We've got Jeanette from Naples. Hey, fellow Floridian here. William Mays in Richmond, Virginia. What are you guys drinking tonight? What are you guys drinking? I want to hear what you guys are drinking tonight. We got Jeff Riley. Oh, Frank, what's going on, compadre? We got Steven from Jacksonville, Florida. Got more Floridians on board tonight. This is kind of cool. Matthew, dude, Matthew, I'm so glad you're here tonight with your Houston and your Diet Dr. Pepper. Jeanette's your first time on here. Well, welcome, guys. All right, we got a full house on board, so we're going to go ahead and get started because we've got a lot of interesting questions, and I'll be tackling a particularly ticklish topic that I haven't covered yet on the show, but the way this question came in, it warranted being covered, and I'm going to leave you with that for a little while. We've got Brett with Brett, you're not allowed to bring water on the Cozy Talk show. You got to put something more interesting in your cup. Frank, dude, come on. We got Daryl from Southern Indiana, lemon water, lemonade with rum. Now we're talking. Thank you, Kenny. We got Jeanette with coffee. Hey, Pam. Oh, Pam's on board. All right, guys. Stephanie from Maryland have emailed you with love arm amputee topics. I am with you, Stephanie. I've actually got a couple of feelers out with regards to expanding a little bit on upper extremity amputee talk on this show because, yeah, y'all don't get enough love on this show, and we need to change that. In the meantime, Stephanie, if you do have specific questions regarding upper limb amputation, I would love to be able to answer them for you. And if I don't have the answers, I will certainly find them for you. No, Brett. No, Brett. No, no wine tonight, Mark. I'm actually not a really big wine drinker, much on the alcohol to begin with. It's usually just the decaf here. All right, guys, for those of you joining me for the first time, my name is Kosi Belloso. I'm a physical therapist, amputee specialist here in Tampa, Florida. I've been a PT now for 18 years. And I have a private practice here in Tampa that is exclusively for working with amputees in the limb loss community. So, very excited about tonight's show. Lots of questions been coming in. And for those of you who are newcomers to the show, you can reach me. Whoops, lost my screen there for a split second. You guys can reach me pretty much on all the platforms. You can send me a message through my website, through my Facebook Messenger, through my Instagram Messenger. And I welcome the questions. It's a very interactive show. This show is for you guys. So I want to answer what questions and what topics that you all want to talk about. And those of you who have been with me, you know that if I don't have all the answers, and I definitely don't, I find people who do have the answers and can help out with that. So don't be shy. Start throwing in those questions. Hey, Chris, thank you. You like my shirt? It's one of my favorites. All right, guys. So this first question comes in from George. George says, I'm not sure when I have the right socket fit. I just don't feel stable enough to take the leap from cane to walking unassisted. My socket just feels foreign to me. I've tried pin lock and lanyard sockets, and next I'll be trying the suction suspension. But I'm wondering if my expectations are too high. What do you think? What should I be feeling? Please advise me. Thank you. George, your expectations are never too high. Okay. A lot of times when folks become new amputees, they think that's it. I just have to settle for whatever leg they give me. It's going to be uncomfortable and painful, and I just have to learn to deal with it. No, 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 and no. Okay. That being said, when you find that prosthetist that's going to make you this amazing leg, be aware that it is going to take time to get that right fit. For many of you, it could take up to a year and a half. Why? Because you have so many changes going on. Your limb is rapidly shrinking. You're trying to get your mobility established. Your weight might be fluctuating. You're still in that healing process. So getting the right fit on that socket, which is paramount to being successful with your prosthesis, is going to take time. And those of you who know me, you know how much I advocate for having that open line of communication, not only with your physical therapist, but with your prosthetist on how your socket is fitting and how things can continue to be tweaked and adjusted to make sure you get a comfortable fit. So, George, the right socket fit, and again, guys, I am not an amputee myself. I am going based off of everything I've heard from my patients for the past 18 years. The right socket fit is when you can put your leg on in the morning, you go about your day, and you're really not thinking much about your leg until you take it off at night. And yes, that is possible. Okay, that is possible. For me, it's all about that prosthetist, finding that skilled prosthetist who will continue to work until you get that right fit. Now, how should that fit? Matthew, you hit it right on the head right there. The socket should fit like a well-fitting glove, okay? It's Goldilocks situation. Not too tight, not too loose, just right. And like fingerprints, everybody's fit is unique to them, to their own, to their own. And guys, you guys are chiming in right here. So I'm going to read out some of these comments right here. Jeanette, well, you're in the right place, Jeanette. You have an upcoming left upper above knee amputation on June 17th, and you're scared. And Jeanette, you're in good company. There's a lot of people here who can probably relate to what you're going through right now and help you out with that. So I'm glad that you're here tonight, Jeanette. Hey, Barbara. Love this. Okay, so Casey's talking about the suction suspension. So when it comes to suspension, guys, when it's somebody who's fresh to an amputation and new to the socket, I usually don't say, okay, let's change suspension first. Usually it's about saying what is causing the fit not to work. If the person is rapidly shrinking, okay, then usually, and let's say, for example, and actually I have a patient like this right now, a patient who has a lanyard socket. It's usually a very good beginner socket for many patients, right? Person's shrinking a lot, so that lanyard socket is getting to be too big, okay? But if everything else about that socket is comfortable, my recommendation, and again, everybody has a different approach, is keep that same system, just remold the socket. Make a new socket for the right fit, okay? Once the person is kind of whittled down and plateaued a bit on their volume and they've got, more or less a plateaued limb volume shape, then I think that's a good time to examine, okay, what's going on with their suspension system? Is there something that can be improved upon the suspension system? Or is this working just fine for the patient? A lot of times people want to jump the gun and get the highest level technology, get elevated vacuum, and it's not necessarily needed at that point in time. Okay. In the beginning, I'm of the mindset of keep the setup as simple as possible so that you can really tell what's going on. When you start adding on all these fancy bells and whistles and then things aren't working out well, it's kind of hard to tell, well, where's the problem coming from? If the setup is nice and simple in the beginning, guys, and I'm just talking about in the beginning, those first few months to a year that you're starting to wear a socket, if you keep things simple, then it's easier to tell what's going wrong if there's something that needs to be adjusted. And there's some people, there are some prosthetists who think the opposite, that they know right away, nope, I want to put this patient into an elevated vacuum, or I want to do this, or I want to do that. Different strokes for different folks. Okay. The point is making sure that you realize what is working for you. And if it's not comfortable, then you need to speak up, no matter how many times you have to speak up. Yes? Okay. Let's see. And then the second part of this question is, George was saying, I don't feel stable enough to take the leap from cane to walking unassisted. And again, this could be issues going on with the socket, but if you're also a new amputee, that big word that I like to use all the time, proprioception, is another big culprit. Proprioception meaning your body's ability to know where it is in space. And that is a sense and a skill that is lost with amputation. And it has to be relearned along with balance, along with strength, along with stability. Okay. So again, this is where your team approach, guys, is so valuable. Your physical therapist is really going to be able to tease out the deficits that are coming from you, the deficits in strength, range of motion, balance, coordination, proprioception. And the prosthetist is going to be the expert on finding the deficits that are coming from the leg. Now, there's a lot of overlap between the two. The PT can chime in about things going on with the leg, and the prosthetist can chime in about things going on with the body. But this is where you want those two sets of eyes, okay? And as an example, guys, tomorrow, one of my patients, I'm going to be pretty much all day at one of my favorite local prosthetist clinics here in St. Petersburg, and I'll be working on several patients from that particular clinic. One of my patients, you guys have been seeing me post videos of him and his progress, and he's been so kind to let me video him and put the videos on Facebook so that people can see his progress and be encouraged by it. So just a quick story on him. He has not walked in the 5 years since he had his amputation above the knee. A lot of stuff been going on with him. And we just started working on physical therapy, and he has been working so hard. And in a video that I posted a week and a half ago, you guys saw how he walked outside of the parallel bars with a walker for the first time. Many of you commented that his socket and his alignment were off, and you were absolutely right. So now that he's upright, now that he's walking, we can actually get a really good picture of what that socket looks like and what needs to be adjusted big time. And we're going to be doing that tomorrow, and we're going to do a live segment on that tomorrow morning. So for those of you who are wondering, what is it like when a physical therapist and a prosthetist can work together to help a patient? Check it out tomorrow. All right, let me read some of these comments. Jody says, how do you put your liner up when you get your nails done? Or shouldn't you get your nails done? Of course you should get your nails done, Jody. That's a really good one. See, I can't keep nail polish on because of what I do. It just won't stay on with between 4 kids and working in a physical therapy clinic. Nail polish just doesn't work for me, unfortunately. So that's curious. Any of my ladies want to chime in on this one? Definitely making sure that nail polish is nice and dry so you're not smearing it on your liner. That's definitely a must right there. All right, we got a question. We had a comment here. Sorry, guys. The comments sometimes go up and down, up and down. So I've got to scroll back to where I was. Stephen says, it took me a while to drop the Canadian crutches, and one day it just happened. I was in the kitchen and walked the 10 steps to the bathroom. Olga, there you go. Jody, Olga says, carefully, I use mainly the palm of my hands to roll it on. Let's see, Tim says, people should take the time every day to ensure the fit is optimal before starting the day. Absolutely. Let's see. Casey says, agree about the lanyard. And again, guys, many of my patients start off with a very basic lanyard or a pin lock system, and it works just fine for them. I have nothing against elevated vacuum. I've seen some patients who have some wonderful success with elevated vacuum, but again, you're talking about added technology, added moving parts there, and you have to take that into consideration. The cat just keeps getting everywhere. You have to take that into consideration for the person's lifestyle and how they're going to be able to manage that. Let's see. All right. Okay, so Susan says, my specialist wouldn't allow me to have the elevated vacuum system until I was an amputee with a pin lock for 2 years. And again, guys, and I have sometimes I'll have a prosthetist on board, and it's nice to hear from them. Every prosthetist that I've talked to, they have a slightly different approach as to how they recommend these things for their patients. And there's definitely more than one way to solve the problems and obstacles there. Okay. All right, guys, sorry, I'm just trying to get through these messages and make sure I'm picking everybody up. All right, guys, so let's move on to this next question from Steve. Steve says, lots of snow and ice has kept me in the house for a few weeks plus. I don't often wear my leg around the house. I may be doing myself a disservice. Is there an optimal and or minimum time I should wear my leg daily? And he also adds, I would like to see a segment on alternative sockets. So Steve, I didn't forget about that part, and I actually have to send you the link. I did one on adjustable sockets. It's actually been a while. It's been a little over a year since I've done a show on the different types of sockets for below the knee and above the knee amputees. And I did do a segment on adjustable socket technology. So I'll be happy to send you those links. They're in the video section of the archive in the Cozy Talks Facebook page. But to your original question, I'm sure there's some of you who might, and if you guys don't mind throwing that into the comments section, those of you who are stuck indoors right now because of this crazy cold weather that we're having, do you continue to wear your leg indoors in the house, or do you primarily move around without it? So Steve, for me, it's kind of like the retainers. Those of you who had braces, and Lord knows I spent a lot of years in braces in my younger years, right? And after they take off your braces and they put a retainer on, and you're supposed to put the retainer on every night to keep your teeth from shifting and from moving. So what happens when you take your retainer off and you don't wear it for several weeks, when you try to put it back on again, it doesn't fit right because your teeth have shifted. So from what I've heard, okay, some folks will say, if they don't wear their socket for a certain amount of time and they try to put their socket back on, whether it's a few days or maybe even a few weeks later, they're finding it doesn't fit quite right. And a lot of it has to do with volume changes in the limb. Okay. So, there could be weight gain, there could be water retention going on. Okay. And if you're not walking on that limb continually and kind of keeping the flow of the soft tissue, the flow of the circulation going through there, those things can happen. And then obviously the longer you extend that time without wearing the prosthesis, then you're going to see changes in the soft tissue itself, either with atrophy or, like I said, a little bit of weight gain. So Steve, I think that's really dependent on the person. If you notice, yeah, it's been a day or two, and when I put my socket back on, I'm having a lot of trouble getting the socket on, then that's something you might want to take into consideration and make a point of wearing it for a certain amount of time every day. And then I guess my second question would be, are you moving around much in your house? And that's something we have to consider in these days with COVID, where we're being shut in our homes a lot more. We're not able to mobilize as much. We're not moving around as much and getting that exercise that we need. So I would say, try to wear your leg as much as you can. And it's kind of a use it or lose it mentality. The more you get used to not wearing it, the harder I think it's going to be to kind of put it back on and get back into that rhythm. I'd like to hear what you guys have to say about it, though. So Susan loves the elevated vacuum suspension, been on it for years. And there's many people that I know of that really like the elevated vacuum. It makes them feel like more connected to the socket itself. It gives a lot of stability to the volume in that limb. Jody says, I wear my prosthetic from morning until bedtime. Jeanette says, is it true that amputees have a shorter lifespan? That's a really interesting question, Jeanette. I don't think I've ever been asked that before. I can't tell you any numbers right off the top of my head. I think the 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 act of having a limb removed is not necessarily what's going to impact your lifespan. I would think more, Jeanette, what were the circumstances surrounding the amputation? So, for example, if you have a young woman in her 20s who is extremely active, who lost her leg below the knee due to a motorcycle accident, okay, and she has no other comorbidities, and then after amputation, she gets back to her active lifestyle, okay, and is able to do sports and lead a healthy lifestyle, then I would expect that her life expectancy would be the same as a person who didn't lose their limb. If we're talking about someone who is in their 50s or 60s who lost their limb due to complications from diabetes, due to complications from peripheral vascular disease, kidney disease, autoimmune disease, then for me, the life expectancy and the lifespan is more determined by those comorbidities than the actual amputation itself. Does that make sense? Because, like I say, just because you've removed the limb does not mean that you've removed the diabetes or the peripheral vascular disease. Those diseases are still present and active in the body. So a lot will be determined, that person's quality of life, that person's life expectancy will be determined on how they can manage those diseases. Now, here is an interesting question, or an interesting statement that I learned, that that we learned back in physical therapy school. People who have hip fractures, older people who have hip fractures have a high morbidity. And I can't, don't quote me on these numbers, guys, but I believe it was people over the age of 75, don't quote me on this one, who experience a hip fracture have a much, much higher risk for mortality those first 5 years after hip fracture. And it's just, as students, we were going, well, why is that? And it's like, well, the person who has the hip fracture will not have the tendency to move around. And if they don't regain their mobility, right, lose their mobility, lose the ability to maintain their health through their mobility, in many cases, because they're not moving around as much, they're not able to participate in their lives as much. Many of them will go into depression because of it. And this kind of leads into that downward spiral that leads to an earlier mortality. Okay. So the whole, will amputees have a shorter lifespan? It's more about what is it that caused the amputation and what else is going on in that person's life, in their health. A lot of amputees, my one patient, it was a wake up call for him. He lost his leg due to complications from diabetes, and he realized it was a wake up call, and he went and he lost 60 pounds after that. And I credit that to being what's going to help him have that quality of life, that healthy life that'll let him live those longer years from now on. Okay, so that's a very interesting question, Jeanette. Pam says she always wears her prosthesis. William says, yep, on in the morning, off at night. Megan says, how do I feel about the Martin Bionics socket? That's a very interesting question, Megan. I personally do not have as much experience with the Martin Bionics socket. I'm a little bit more familiar with the Limb Innovations adjustable socket technology. That being said, I've spoken to a couple of prosthetists who are experts in fitting Martin Bionics sockets, and they have really great outcomes. But I will say this, Martin Bionics socket, it's a very, very specialized socket. So it needs to be done by a prosthetist who has been trained to make one. And again, that's just, again, from my observations in the community and when I've spoken to different prosthetists in different clinics. My impression is I believe that they changed their model a little bit in Martin Bionics. So if you are interested in the Martin Bionics socket, I believe you must travel to one of their clinics, and I believe they're expanding. That's all I know. I really don't know as much about it. But I think if you can look up that information on their website. But yes, Megan, the people that I've seen who are fit for Martin Bionics sockets by a specialized prosthetist, they have good outcomes and they do like their sockets. Susan says, I'm Canadian, so I'm used to the snow and the very cold weather. Barbara says, I wear my leg in the house. Chris says, I wear mine 16 to 18 hours a day, no matter if I'm indoors or outdoors. That must be a really well-fitting socket, Chris. Matthew says, if I'm not wearing it, I am in my shrinker. And that's a really good point, Matthew. If you are someone that when you're at home, you're like, forget it, I'm not wearing my leg, I want to just use crutches or a walker or wheelchair. wearing that shrinker is definitely something I recommend because it can help keep that limb volume nice and stable. Okay. So many people are like, oh, shrinker, I'm wearing my leg, I can throw the shrinker out the window. Not the case. I always tell people hang on to your shrinkers. Many of you still continue to wear them at night to help stabilize that limb volume. And also for cases like this where you're stuck indoors for much of the day and you don't want to necessarily wear your prosthesis. Okay, so Rhonda says, yes, inside due to the weather, but wear my socket and leg every day. Let's see, Jennifer Lynn says, I've been in a pin lock since my right below the knee amputation 3 years ago. I love it. Tried suction, but suction was not a good fit for me. Everyone is different. You're absolutely right. You're absolutely right, Jennifer. And it's one of those things where I've stopped saying, well, I don't like this or this thing is bad or that thing is bad. For me, it's more of just looking at it now and saying, okay, this particular technology is going to work for this individual, but not this individual. That's just how I've learned to look at technology, whether it's a prosthetic foot, knee, suspension system, liner. There's so much good stuff out there nowadays. And to put something out on the market, these companies really need to be on their game. So the majority of things out there are really good products, but you got to figure out, okay, which one's going to work for which individual and their lifestyle. All right, let's see. Excuse me, guys. Susan says, so true. I had my leg off for a week, and when I went to leave the hospital, I couldn't get my residual limb into my socket. And that brings up another point. Some of you who find yourself going into the hospital, whether you're having a procedure, whether you have an illness, whatever it is that has you going into the hospital, I always try to tell you, take your leg with you. And at whatever point you're in that hospital, ring for the physical therapist, ask for them to have a consult with you so you can get up and moving. Regardless of who you are, if you're stuck in a hospital for whatever reason, the more mobile that you can stay, the better your recovery process will be. But it's just that much more crucial for an amputee because of the fact that you have all these issues that could possibly happen with your residual limb if you're not up and moving as much as you can. So if you know that you're going to be hospitalized or you've been hospitalized, have a family member bring your leg in and just see if you can, if you're allowed to have out of bed orders, see if you can wear it while you're in the hospital. Benny says, I kept mine on since I've been stuck inside. Phyllis says, I wear my leg almost daily, so far about 8 hours. That's really good. Charles says, I always wear my below the knee leg. My stump changes shape and size volume when I do not wear the hard fitting versus my stump sock. Yeah. Let's see. Susan says, I wear my leg from morning until night. Excuse me. Ashley says, because of the weather, I've been teaching from home for the past week and I've been having a lot of achiness. So I have been going without my leg as much. But on a typical day, I have my leg on for 14 plus hours. Bless your heart. Trent says, hate to ask, but is your mic covered? Having mic volume? Oh, sorry, guys. My mic is right here. Is anybody else having any troubles hearing me? Sorry about that. I have a new microphone system that my tech team gave me, which it was so lovely. But as you can tell, I am still trying to figure out how to use it. So if anybody else is having any trouble hearing me, please let me know and I will try to push buttons and see if I can make that any better. Okay, Stephen asks, I'm a left above the knee with a short residual limb. I've had the pin lock, seal and liner, and the Össur movable liner. Willow wood, one elevated vacuum, and the skin fit. Trouble with the seal and liner is slipping in the summer here in Florida from sweat. My prosthetist is going to try a lanyard system next. Do you have any suggestions? I was going to say, it sounds like you guys have kind of run through all of the things that I would have recommended. The pin lock, something I would have recommended. I think the lanyard might be a good idea for you, Stephen. Also considering kind of old school hip belt. So way back when, with the above the knee amputees, the suspension involved putting a suspension sleeve on, and it would go around the waist. Granted, with the Florida heat, that can be a little bit hot, but it's also very good at keeping that leg on, Steve. And I know that, for example, many of my athletes, when they're getting into those high level activities of running and they really want to make sure that that leg stays on nice and tight, they will add on the hip belt, and it goes basically around the hips, and it also does the favor of controlling the rotation on the socket, especially if you have a very, very short residual limb. I know that, and again, I'm very careful when I make these recommendations, just because it is a very intense surgery and procedure. I know that some folks have opted to have to look into osseointegration, and again, not saying that that is something that you should look into, but it's just something you should know about. Osseointegration is the procedure where they put a metal rod implant into the femur, and the metal rod then comes out of the end of the residual limb, and the prosthesis attaches directly to that metal rod, so it eliminates the need for a socket. But again, Stephen, that is it's a very involved two-part, in some cases two-part surgeries with a year-long recovery process. I know that there's a couple of few surgeons here in the United States that are performing that procedure and undergoing, waiting for FDA approval, full FDA approval. So again, it's one of those things that it's out there, and it's also just good to know about it. But Stephen, I would ask your prosthetist to, just old school, ask him about a hip belt and see what they say about that. Karen says, and the pain that comes with it after a week of not wearing the prosthetic. Yeah. And again, guys, you all know your bodies better than anybody else. If you're somebody whose limb stays nice and stable and you don't have any problems with volume changes, then obviously you can get away without wearing your prosthesis for a little bit of a longer period of time. But many of us have those changes in our weight and changes in our volume in our limb, which can make it particularly frustrating to have to put that socket back on again after you've had it off for a few days. Okay. All right, guys, okay, so Stephen says the average lifespan after amputation is 5 years. I researched the topic, but you know what, Stephen, I'm very wary when I hear numbers like that, just because it's really not taking into account the individual nature of each amputation. And again, you could have someone who lost their limb due to cancer, lost their limb due to a traumatic accident, lost their limb due to diabetes, so many other things going on. And to me, it's more about that will determine mortality. And again, if the proper care is given, and that's another big one right there in some of these studies. And that was the study I just referenced a little while back about the hip fractures. Okay. And that was an early study done years ago, where it showed the difference between the people who received physical therapy after their hip fracture versus the people who didn't get physical therapy, and the stark difference in the outcomes. Okay, it was their lack of mobility that eventually led to that mortality. Why? Because if you're not moving around, okay, you have the psychosocial issues of depression setting in. You have physical issues, more increased risk for blood clots, more increased risk for cardiac disease. So many of these things that can be prevented with mobility. Okay, so Stephen, yes, some of the research might say 5 years, but for me, I just say look at the individual and see what's going on in the rest of their life. All right, guys, I'm just trying to scroll through. Okay, so Kenny Jones, this was a question that he sent in. Kenny says, I'm a new amputee as of July 2020, so not even the 1 year mark yet. I'm in 8 to 11 ply socks. My leg below the knee keeps getting loose. Going to talk to my prosthetist, but wondering if you had a suggestion. And Kenny, you kind of picked up on the flavor of the conversation we were just having. That first year, okay, that first year after amputation, your limb is undergoing a lot of changes. And I know there's going to be a lot of raised hands saying, yep. And go ahead and tell Kenny for you guys. William says some of us are just too mean to die. That's just crack me up, William. All right. So again, lots of changes going on in that first year after amputation. Those soft tissues are trying to heal, trying to remodel. Your body is trying to manage all that inflammation and edema, moving it out of that residual limb, trying to get acclimated to a new shape. So Kenny, the fact that you're already in 8 to 11 ply socks, that just means your body's doing what it's supposed to be doing, that residual limb is starting to shrink down and everything is starting to remodel. So that is a very normal part of the process, and it's a very normal thing to have to go back and get your socket redone several times in that first year. I've had some people tell me up to 6 or 7 times getting a new socket. Okay, and you're inching up on that ply. The textbook will tell you 15 plies when it's time to get a new socket. For me and a lot of the prosthetists that I speak with, they say when the person starts losing that connection to their socket, when they start having problems, when they feel like the leg is just going to fall off or they're not as connected with the leg, then that's the time to talk to the prosthetist about getting a new socket made. Okay. So Susan says, Kenny, I went through 6 sockets due to shrinkage in the residual limb. Good heavens. Phyllis says, I'm 5 months post-amputation. Harsh says, from a cylindrical to a conical shape. And again, everybody's a little bit different, and also depending on how the surgeon did the amputation. The nice textbook shape is like to have that nice little conical shape in the residual limb. Casey says, Kenny, I easily went through 8 sockets in my first year. Holy smokes. All right, guys. So this next topic, hang on. This next question came in. And at first I was a little hesitant to answer this because this is not my area of specialty. This has definitely become a highly specialized area in the field of physical therapy. Quick poll. How many of you out there have heard about pelvic floor physical therapy? Just quick show of hands. Now I'm going to drink some coffee while I'm waiting for you guys to put those in the comment section. How many of you have heard about physical therapists who specialize in pelvic floor dysfunction? Phyllis says no. I have a pretty sneaking suspicion I'm going to know that the answer. Susan says not me. Yep, a lot of question marks. Kay says yes, good. No, Rhonda says no, nope, nope, haven't, nope, 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 nope. Andrea says yes, OT can do it also. Thank you, there's my OT right there. There's my girl. Harsh, you're funny. So basically the answer is no, okay. So a bit of a ticklish topic, but it's one that needs to be discussed. And Andrea, I would love it if you could help me with this one, okay? So I'm going to first read the question that was sent to me, and then you guys are I'm going to give you a little bit of background on what pelvic floor dysfunction is and how it relates to physical therapy. This person says, I'm an amputee right below the knee for 6 years. When I first became an amputee, my residual limb would hurt so badly whenever I had to have a bowel movement. I always said my leg knew I had to go before my bowels did. After 3 years, it suddenly stopped hurting when I had to go, and I was very happy because it was horrible pain. Then I fell and broke my hip on the prosthetic side. The surgeon went in to fix it, and lo and behold, that horrible residual limb pain returned again every single time I had to use the bathroom. It's been 3 years and it still hurts. Okay, and then there's a few more details here, and then it says, feels like nerve pain, and also during intimacy, having pain internally on the side of the amputation. It's a problem. I've been trying to do Kegel exercises and nothing is working. I'm not sure what to do. Okay. Now, guys, nobody has to answer these questions because I understand this is a very personal and private nature of these questions. But some of these questions, and again, this is for both my men and women alike. Okay. Let's talk a little bit about what pelvic floor means, and then it'll give you a better understanding as to where I'm going with this question. Okay. So Bob here doesn't have a pelvic floor anymore, but hopefully he'll try to demonstrate. Okay. When you think about when you sit on a horse, okay, anywhere that your body touches the horse is basically the pelvic floor. It's your pelvic floor. Okay. Your pelvic floor consists of a series of muscles and soft tissue and ligaments. Okay. And think of it like a muscle hammock. Okay. Now, how many of you guys know about your core, right? Everybody talks about core. It's all over in the pop culture, everything about the core, right? And many people think the core talks about the abdominal muscles, okay? But there's actually 4 big components to your core. You have your abdominal muscles, you have the muscles on your back, you have your diaphragm, which is that big juicy muscle right here that helps you breathe, and you have your pelvic floor, your undercarriage, right? All 4 of those components have to be strong and working together to give your body the support it needs to move. Okay? So when you don't have the support, if there's a weak link in the chain, if you have weak abdominals, if you have weak back muscles, if you have a weak pelvic floor, if you're not breathing properly and using your diaphragm properly, okay, that's when you start to have issues and breakdown. For many of you, it's back pain, right? Show of hands. How many of you are experiencing back pain that started after your amputation, right? Now, here's the thing. Many of you are probably experiencing symptoms of pelvic floor dysfunction, and you don't even realize that that is what's going on. Okay. And guys, I am not a pelvic floor specialist. This is a specialty that developed very recently. When I was in school 24 years ago, right? Pelvic floor dysfunction was literally a footnote in one of our lectures. And to me, that's a disgrace. So I'm so glad that now it has become a full on specialty in my profession because we're realizing the impact that it has, not just on women, on men as well, but pelvic floor dysfunction in the human body. Okay. So what are some, Andrea, I was thinking of that same thing. Basically, so with this particular individual who is saying that they were having a lot of pain when they had to use a bowel movement, okay? If you think of just simple mechanics, guys, when your intestines, you need to go, right? Your intestines are full and they're pushing up on the different parts of your body in your abdomen. They have to push up on something. One of those things that they can be pushing up on is your nerves. In this particular person's case, could it be that that bowel was pushing up on the sciatic nerve? Who knows? That's something that needs to be examined a little bit further, okay? But the fact that this individual was also having pain during intimacy on the side of the amputation, it means that there is something going on with the pelvic floor, okay? So guys, think about it. And the most obvious example is pregnancy, right? That's the one that a lot of people we do know about and that causes pelvic floor dysfunction, okay? As the woman's body, as the baby's body starts to grow inside the woman's body accommodates by stretching out a little bit. The ligaments become a little bit loose to accommodate the growth, right? The bones spread out just a little bit to get prepared for childbirth, okay? And that pelvic floor, the hammock, starts to stretch to accommodate for the size of the baby. Okay. So a lot of times you'll hear about women that they have problems with incontinence. They might have problems with pain during intercourse afterwards because of the issues going on with the pelvic floor. And the pelvic floor and everything going on inside of the pelvis, the muscles inside of there can also become a problem. Okay. So what happens? What happens during amputation? Okay. Everything gets thrown off again. Right? Our bodies like to be symmetrical. Our bodies like to be working together. So when there's something that gets thrown off, the weakest link is what takes the brunt of it. Okay? So if a limb is lost, that means that all the other parts of the body have to pick up the slack, have to pick up that stress. So that stress is going to be affecting some parts of your body. For some of you, it means that it's going to cause you back pain. For some of you, it means that you might experience some incontinence as you're trying to use your prosthesis because you're putting so much effort into it. Okay. And again, I'm not asking for anybody to raise their hands on this because I do know it's a very private matter. But if there's any light bulbs going off for you right now, those of you who are experiencing incontinence, those of you who are experiencing pain when you're using the bathroom, that's a big one, that it sets the phantom pain off. Those of you who might be experiencing pain during intercourse, okay, these are things that are not normal, and these are things that can be addressed. And pelvic floor physical therapy, a lot of times people are very like, pelvic floor physical therapy, what does that mean? Like, what does that entail? Okay. So in the same way that a physical therapist, when they're examining you for your prosthesis and how to use your prosthesis, we do testing of your muscle, we do testing to see a range of motion. We do testing to see the flexibility of these muscles and how the muscles are moving and operating together. It's very similar to pelvic floor dysfunction. Your pelvic floor is made up of muscles. So the specialized physical therapist can test to see which muscles are weak, which muscles are tight and spasming in a way that could be causing pain, okay, and where it's coming from. Someone who's experiencing internal pain on the right side could be having weakness coming from the left. Okay. So it's again, it's beyond my professional scope because I have not specialized in pelvic floor dysfunction. And this is something I do refer to my colleagues who are specialists. And for this particular individual who sent me this question, I will be sending her a recommendation for a referral for a pelvic floor physical therapist. And it's one of those things, guys, to consider. We had this conversation. I called it potty talk. We had potty talk 2 weeks ago where we talked about the issues that you face as a new amputee and even as an experienced amputee when you're having to negotiate the bathroom. Okay. Many of you having just to maneuver in a bathroom with a walker, with the crutches when you're visiting some family abroad, visiting family in a different home. How do you manage the shower and situation? So take it a step further. Those of you who have having issues while you're actually using the bathroom during intimacy, okay, these are things that do have a solution. And the pelvic floor physical therapist is the person who can help with this. So I see a lot of comments that were flying in. So I'm going to go ahead and just see. It's a very interesting topic. And again, it's not, unfortunately, it's a topic that is not talked about enough. And there's a lot of people who live with these symptoms and they're either too embarrassed to ask about it, or they simply think, well, that's life. That's what I got to put up with. Okay. And like I said, my male patients, I think, even have a tougher time expressing these things. But they are also prone to these issues, especially as they get older, and they may present with prostate issues. Okay. Enlarged prostate can cause some of these issues. Herniations, men who have hernias. Okay. Again, all related to that core: diaphragm, pelvic floor, abdominal muscles, and back muscles. Ooh, sorry, Snickers. All right. So let's see. So hopefully this, if anything, yeah, Andrea, and some women know, but it's really, it's a little sad to me that many women are not aware of this. And there's so many of, female friends that I have, personal friends, that they say, well, I live with these symptoms and issues because that's just part of getting old, or that's just part of having babies, or my mom had and it's not. It's not. It's something that can be taken care of and really improves the quality of life for some of the folks when I've sent them to the pelvic floor specialist. Game changer for many of them. Okay, let's see. Oh, Harsh. Harsh, I'm still learning myself. Susan says, I had abdominal compartment syndrome. So yeah. And again, this is where the use of a specialist, this is all that they do. So they know how to really pinpoint what is going on and how to determine how to fix it. Olga says, I only get the phantom pain and spasms when I have to go to the bathroom, when I have to poop. Yeah. Harsh says, when I go for a long bicycle ride, now I know what happens. Yeah. Let's see. Sorry, guys, I'm trying to get through all these questions. Right. So many of you are saying that when you have to use the restroom, that when you have to use the bathroom, whether it's number one or number two, that's where the phantom pain starts going off. And again, this is just from listening to my professional colleagues talk. And this is by no means an extensive diagnostic ability here. But many issues related to constipation will also contribute to this. And it can be sometimes as simple as resolving constipation. And it resolves a lot of these symptoms that folks will have. And again, training that pelvic floor, especially those of you who are extremely active individuals, it's one of those things where, the more you demand of your body, the more you need to be on top of keeping it strong and keeping it healthy. Okay. David says, so much to learn, think about, and manage. It is, and it can be a bit overwhelming sometimes, David, because you're just like, geez, feels like the balloon that has little pinholes, and the minute you put your hand on one pinhole, another piece, water pinhole starts poking out. But again, and this is where I love my profession. I love what I do, and I love what my profession does for people. There's a lot of things that there's a lot of specialties within physical therapy, I guess is the best way I can say it. So we can address a whole gamut of issues. And if we, for example, myself, I am not a pelvic floor specialist, but I know to refer out to one. And same thing with other certain specialties that I am not a specialist in, but I know when to refer my patient out to one of them. So again, that's my little soapbox there for saying, along with your doctor, along with your prosthetist, your physical therapist really needs to be a part of your healthcare team, lifelong healthcare team, because they can be a pretty valuable tool in helping make some of these recommendations. Let's see. One personal opinion, you can be one of the best physical therapists. Oh, thank you. No, Harsh. I still got a long ways to go. Jeff says, so much to take in. There isn't going to be a test at the end of this class. No, although I'll have to do a giveaway. I haven't done a giveaway in a really long time. I need to do that. So we'll need to do a giveaway at some point in time. And actually next week, guys, you know what? Sorry, I'm like interrupting myself. I want to make sure I got all the questions. Yes, I got all the questions that came in. Woohoo! Finishing and even in record time. Susan says, I used to be very active, but not anymore. Perhaps I should try harder. I lost a lot of muscle and nerves when I had the ACS, abdominal compartment syndrome, so I don't have strong stomach muscles at all. The beauty of it is, Susan, and this is where the human body fascinates me. Its ability to heal, its ability to come back. Keith, multiple choice. Man. No, man. It's fill in the blank or essay questions with me. The human body's ability to come back from some of these injuries is amazing. And even after being in this field, like I said, I've been studying the field of physical therapy for 24 years, and it never ceases to amaze me how we can bring the body back. We may not be able to bring it back 100%, but we can regain back some of the strength and just the intricacy of teaching these muscle groups how to work together again. Nerd flag here. But to me, I always tell people there's never such a thing as giving up. Don't give up. There's always something that can be improved upon. And Susan, in your case, go for it. Go for it. So to the individual that sent me that question, I will be contacting you to hopefully get you connected to a pelvic floor therapist who can hopefully do an evaluation and let you know a little bit more about what's going on and how you can take care of that. Should every amputee, in your opinion, go through physical therapy? Eli, I don't know if it's Ellie or Eli. I could kiss you right now. Yes. Hang on, let me think about that. Yes. Yes. Now, guys, I promise I won't stay on this soapbox too long, but here's my thoughts, okay? Every once in a while you hear about an amputee who says, well, had my amputation, put my socket on, and I went walking and I walked out of my prosthetist clinic. To those people, I say, congratulations, you are a work of art. You are a genetically blessed person who can do that. To the other 99.9% of people who are not just able to put on their leg and start walking, physical therapy is a necessity, okay? And Eli or Ellie, I'm sorry, I hope I'm not mispronouncing your name. Physical therapists are there from the minute surgery happens, and sometimes even before, okay? I have seen amputees in all stages. I've even seen them pre-amputation when it was a planned amputation and we had time with physical therapy to get the person strong and strengthen the muscles to get them prepared for the surgery. I've seen my patients as their eyes are opening up from the recovery process, from the recovery room, and saying, okay, trying to do some very simple things in the bed, in the hospital bed, through all the phases of recovery, okay? As David pointed out, there are so many things going on in the recovery process from limb loss, okay? You need a full team. You need the surgeon, you need the nurse, you need the psychologist, you need the social worker, you need the PT, you need the OT, okay? And I know I'm missing a lot of moving parts, obviously the prosthetist, okay? And not to mention, it's not just the limb loss, it's as our bodies age. And many of you have heard me say this, our bodies are living longer nowadays, okay? We're living into the 8th, 9th, 10th decades of our lives. And to keep our bodies in shape and moving and healthy so we can have quality of life, you need the physical therapist there to kind of help keep things together and from breaking down. Guys, I have 2 physical therapists that I call upon depending on what my issues are with my running activities and everything that I do. I have 2 physical therapists in my Rolodex that I know to call whenever I'm having a problem, so I can take care of it right away. Okay, so yes, I think every amputee should go through physical therapy. And it's interesting. when people think of, amputee, they never question, should they go see a prosthetist? And believe me, guys, I have nothing but the utmost respect for prosthetists, nothing but the utmost respect. They are the team member that is most important to me as a physical therapist. But nobody questions, should I go see a prosthetist? Of course I should go see a prosthetist. I want to get a leg. I want to get going. Okay. Here's how you can see it. Prosthetist builds the car. Physical therapist teaches you how to drive the car. Yeah? All right. Sorry, all right. Hey, Magda, there's my girl right there. Susan says, I went to physical therapy as an inpatient for 6 months. Phyllis says, OT and PT are so valuable. Thank you, Phyllis. Jeff says, I'm in my 8th week of pre-surgery physical therapy. And that's the thing. And again, guys, unfortunately, insurance has kind of whittled that down. Once upon a time when I was in high school and I knew I wanted to be a physical therapist and I was volunteering in these outpatient clinics, so many people had physical therapy before their surgeries. They had physical therapy before their hip replacement and knee replacements, before their ACL repairs. At that time, I didn't see many amputees in high school, okay? Because they understood the importance of getting as strong as possible before the surgery itself. And it improved the outcomes. And then unfortunately, insurance has slowly kind of been chipping that away. So people don't seem to think that they need it. Karen says, I walked without struggling when walking with the prosthetic. I started with crutches, yes, but I did my own PT of walking around the kitchen for a while. And I do have a lot of people who have a very similar story to yours, Karen, and they learn how to use the prosthesis. Here's my thought for you, okay? And this is just something just to kind of keep in the back of your mind. Many people can figure out how to walk with a prosthesis, and they can sometimes even figure out how to do it without a cane, without a walker, okay? But here's the thing, our bodies will want to take the easy way out, okay? Our bodies will want to get from point A to point B in the easiest way possible, right? So a lot of times that means that our bodies will utilize movement patterns and they won't try to get the muscles stronger. They're just going to use what muscles are there to try to get from point A to point B, okay? With physical therapy, what we're trying to do, okay, is number one, we're trying to get all that strength back that was lost. Number two, we're teaching the body how to move as normally as possible, which is sometimes a lot harder to do in the beginning, to try to reestablish those movement patterns, that balance and that coordination. It's a lot harder to do and it requires more effort. And the body does not want to have to expend that effort if it doesn't have to. So what happens is people learn how to move, compensating, and then later on down the line could potentially run into problems. Problems with back pain, problems with pelvic floor dysfunction, problems with the sound leg, okay, because the sound leg is taking more of the stress and abuse, okay? So again, this is where the physical therapy, and the earlier the intervention, the better. And it's never, and again, I'm going to read, it's never too late. If you've never been to see a physical therapist before, my recommendation to you would be find one and do your homework before you actually need one. Find the physical therapist, establish a relationship for them, and just see what it is that they can do for you. Kay says, yay for OT, though I love PTs as well. Well, thank you, Kate. Cheers to you. All right, let's see what else. We got a lot of great comments here, and I want to make sure I get them. Megan says, I had physical therapy, but she had never had an amputee patient. And guys, that is something that is unfortunate. There's not a whole lot of us out there who are specialists, but there's several ways to approach that, Megan. And one of the number one first thing to do is try to see if you have a specialist in your area and looking outside your zip code. Looking, guys, in my clinic, I actually get more people coming to me from outside of my zip code who drive more than an hour to see me than my local folks, okay? There's not many of us around, but we're worth the effort finding, okay? Second thing to that, if you really cannot find a physical therapist who's ever seen an amputee before, okay, it doesn't mean that you can't find a physical therapist who can't help you, okay? Keeping in mind, as a physical therapist, all of us receive training, extensive training on the gait cycle. That is our bread and butter, okay? That is the foundation, pun intended, of our profession. And there are many of us who do gait training for neurological patients, patients with strokes, traumatic brain injuries, patients with spinal cord injuries, pediatric patients. A lot of the techniques that I use, guys, come from my days of working with pediatric patients. Okay, so sometimes it might mean getting creative and finding a therapist who works in an inpatient rehab center, somebody who has experience with gait training with stroke patients, who's willing to then communicate with your prosthetist to learn about the componentry that you're using, and you can come up with some very successful treatment plans. And there are several of you out there that have emailed me and have said, my therapist wants to learn how to help me. Can you talk to them? Yes. That's the beauty of social media nowadays, and our global, our globe is shrinking little by little. Sometimes you got to think outside the box and get creative and say, okay, well, if I have a physical therapist here who's willing to help me, who wants to help me, and who wants to learn, how can I connect them with another physical therapist who's a specialist? How can I connect them with my prosthetist? That's probably the best thing you can do, is get your prosthetist and your PT to talk together, okay, and go from there. All right. Brett says 20 visits a year. That's yeah. 20 visits, guys, disappears like that. Disappears like that. Your average, and this is textbook. This is just like, there's no complications. The person has a textbook recovery. Your average above the knee amputee can take anywhere from 12 to 20 physical therapy sessions to learn to become independent with the prosthesis. And again, textbook, no problems with the socket, no problems with the person's health. So it disappears pretty quickly. Casey says, did inpatient and outpatient physical therapy after your amputation and once I got my leg. Wafa, oh, Wafa. Oh, I haven't seen you in a long time. I'm so glad you're here. She says, hi, COSI therapy, very important because when you are an amputee, it's to get you strong and get you forward in life. Absolutely. My request to please all become advocates on Amputee Coalition. Okay, Jeff says, I talked to the doctor and he ordered the physical therapy. Good. Oh, thank you, Harsh. So Sandy says, I was the first amputee for my physical therapist, and he learned with me when I was almost done, and there were 4 more amputees there. And guys, at one point, I saw my first amputee patient. And when I saw my first couple of amputee patients, I didn't know what I was doing. We didn't receive a whole lot of training in school. In my case, I was extremely fortunate that I had a senior therapist who was one of the top amputee specialists of his generation. But I also had the prosthetist right down the hallway. So my ability to work with the prosthetist and for him to teach me about the prosthetic devices, again, I had that foundation in gait training and how to teach the gait cycle. I just needed to learn about the componentry and what was specific to the amputee and learning to apply that. Okay. And I am so grateful to my early patients who were so patient with me. But I will tell you this, guys, when you have a physical therapist who has a desire to help you as an amputee, that's like a dog with a bone. Okay. You're going to have a physical therapist who's really going to dedicate themselves to learning whatever it is that they can to help you out. So, my physical therapist was expert on treating kids with polio, and he did an excellent job early on with me. Yeah. And again, and this is maybe why I went into the field of amputee and I specialize there, is because I get to draw upon all of my skills. I get to draw upon the skills I used with kids, the skills I used with working with stroke patients, spinal cord injury, even some of the skills I used with working with burn trauma patients. Okay, and utilizing it all with some of my amputee patients. Oh, Wafa. Wafa, I really hope we get to meet up at Amputee Coalition Conference. I hope the cards are in our favor and that we get to go so you can teach me how to do belly dancing. I haven't forgotten you're supposed to be teaching me. Let's see. Steve Popilio is an amputee specialist here at Brooks Rehab here in Jacksonville. Steven, I need to get in touch with that person. I need to get in touch and grow that network. Phyllis says, my prosthetist was good. He made house calls. Not sure if that was normal. It is. It is. And actually, as a physical therapist, I worked the home health sector for 8 years. And in my current practice, there are occasions where I do visit the patient's home to work with them from the home. And I do know of certain prosthetist clinics that also offer that service. Keith says, my insurance allowed me to get extra PT days after the 20. And again, you know, with insurance, especially Medicare nowadays, kind of putting the boot right on our neck as PTs. A lot of it will depend upon the documentation. You know, if the physical therapist can provide adequate documentation showing that the person is demonstrating improvement because of the physical therapy and that they have the potential to continue to improve with physical therapy, then there's a better chance that the insurance will continue to approve these visits. But yeah, it's unfortunately pulling teeth sometimes. Oh, Susan, I appreciate that. Thank you so much. There you go. And guys, you know, like I said, get creative. Get creative. There's so many ways that we can connect with people nowadays with social media and everything going on, that you can find these specialists that you need in some of the most interesting places. David, I hear you, David Franklin. I hear you. I know. I hear you. Oh, well, thankfully, I'm not the only one out there, Kay, and there are more of us growing out there. The nice thing is also with your questions, I'm getting a lot more students that are sending me email messages and asking about how they can learn more about how to help amputees. So that's just a really positive thing. And I know there's a group of us on Facebook, and then there's a group I know in South Florida and in California. And we're kind of scattered here and there throughout the United States. And one of the nice things about this show is I've been able to network and get to know more of my colleagues in this field and be able to refer people out. And hopefully we'll be able to have a bigger network there to refer folks to and getting that help. Excuse me. All right, guys, I think I'm going to wrap it up for now. Guys, before you go, especially some of my new folks who are on here, I am trying as best as I can to grow the platform through the Facebook, through Instagram, and through my YouTube channel. Everything is under Cosi Talks, nice and simple. And also, here's the one thing, if you guys haven't done this already, and I'm going to type it in here. This is my shameless plugging. I promised my tech team I would do this. All right, guys, I just posted the link to my website. If you go to my website, you can sign up for my email subscription. That is the key to everything right there. If you sign up for my email subscription, I promise you, I only send out 1 email a week. And in it, I include all the links to all the new videos out there because I'm posting them on all the different platforms. And some of you are like, I want to be able to see the video, but I don't know where to find it. If you sign up for my email subscription, you'll get all the videos to all the links, all the new stuff I'm going to be putting out on YouTube. People on my email list are going to be finding out about it first. The top secret project that is now going on 6 months that I'm working on, those are going to be the people that find out about it first. So if you have a moment after the show shuts down, go to my website at www.cositalks.com, sign up for the email subscription, guys, and you'll get all the news there. All right, guys, as always, hey, Pat, there you are. As always, guys, thank you so much for letting me be a part of your lives this evening. I will see you next week, same bat time, same bat channel. God bless, guys.